Department of Health for now e eteletse pele ke DDG Basani Baloi khopela o emise letsogo yeah so re tla re he re ya ko di apology then re tla tlhalosa hore ke bo mang ba ba le mo meeting mara ke a le amogela mo meeting bile ke le leboga gore every time e re na le meeting le a tla ba bantši ba lena so that le tlo mamela gore re bolela ka eng so before bile ke subella ko gole ka di rules tsa go legislature pleke e re declare gore ke precinct ya legislature go thoma no ge meeting o thoma go fitlhela ge meeting o fela pleke e re le mo go yona e emetse legislature ya provincial government ya Gauteng akere so dilo kaofela he re dira mo re tla be re le batho ba go legislature so le tshwere program rule e re berekang ka yona gore pleke e ke ya legislature ki rule 57 sorry rule 56 because are ko legislature e dulang ko Gauteng so ke a leboga rule 56 ya re dumelela now item 3 ke di apologies ke received apology from Honorable Duplessis a go mo meeting ka baka la mabaka a rileng ke ena rometseng apology ya bobedi ke Honorable MEC wa Health o etla mara o tshwaregile somewhere akere today ke Nurses Day ne so we ile ko Nurses Day then ha tloga kwa o tlo re joina mara like ke boletse gore me pasani o mo so MEC ga re joina me pasani tlebe a le mo o tlo introduce ba tsamaya le bona leadership ya Department of Health gore le bone gore Department of Health e tlile le bo mang mo gaufi le nna mo ke Honorable Litsie so le ena o hona mo Honorable Litsie Mogale le ena ke committee member and then ke na le ntate Mpapa Kanyane le ena ke honorable member emisal tso ke member Litsie and then ke member Kanyane are phaphatheleng rena ba bohle le committee matsogo ke a leboga ke tlo khupela hore me Pasani Baloi mo legatong la Department of Health in Gauteng a bolele hore o tlile le bo mang yena re sa emetse MEC mara ke re boseka buija
Abshin dumelang sanbonani locha macheron Naki Basani Baloi, I'm the Deputy Director General responsible for corporate services. So on my left, Kitamaili Medoda, or Aling responsible for finance. Today, go meeting or Chair Otlaba Ekta as a CFO. And then Renali Mope, I can't see here. Memope Kibale Kibonaba acting as a Chief Operations Officer. Kinali Ntate Kobo Bonaba actor as a head ya infrastructure. Chair Kibonaba Kibaboning so far. Honali Baba Wertla. And then to apologize, Chair, Li HOD Unali MEC Ko Pulusong, that's why I'm leading the delegation. And go officing ya MEC Renali Chief of Staff Unaduzimo Waroko Yelo Litla Mona Hapa Hahut Ki Me Hauhelo Malisa. Thank you.
Realeboha and memupe whatever ratson la go dula ko leader from the front. I really did from the back. So the officials be ba le hona ka mo pele mo hantshire ba beela ditulo gore ge ba tlo araba di questions tse le di botsisang re ska mo nyaka somewhere re sa mmone akere. So to item number 4, re tlile mo gore Department of Health e tle re bolele ka budget gore budget ya bone e bereka bjang le diplane tša bone for ngwaga o ohle le gore ke bokae e bereka eng for eng le eng le eng. Then lena after ba presentile lena le monyetla wa gore le botsise gore why go sena 1 2 3 or why kore go tswa go lena gore ge ba presenta e tlo ngwadiwa le mola le tla e bona gore le kgone gore mara e la o ka re kore go tswa go lena kere re tlisitse go lena gore lena e be lena le question mo le mola kere re ya kwana kere so kore ge le mola e no ba fa mahala lena le tshwanetse le botsise gore why akere why o ka re ya ho ha di clinic ya shota a ke sho le nna mara ke no ra gore lena le iputisetseng gantši ge le tlile lena le tla le tše dingwe tše di sa tsamaelaneng ba bang not lena kaofela kere ba bang ba tlisa tše e leng gore a ra tla ka tsona tše dingwe re tla di araba mara tše dingwe dikarabo re a go di nyaka ko pele akere because a ra tlela tsona department e tla araba tše dingwe re tla bona ko pele. So ke tlo bušetša mike go DDG Baloi gore a kgone go continue ka presentation e re tlo e kry-ang and then lena le ngwaleng fatshe gore le tle le kgone go botsisa di-questions akere ke nagana gore ke a leka gore ke bolele ka polelo ya se-Africa and then mang le mang o free go bolela ka ye yena a e kgonang akere re a kwana akere le bolela ye lena le kgona a go tlhokagale akere akere re ikreile tseleng a ra e nyanya ko hae akere le feeling free go bolela language e lena le ratang re a kwana akere DDG Baloi nako ke ya gago mme.
Thank you, Chair. Go tlo presenta Medoda wa Sotho mara mo tlo trying go tlhalosa hantle ka la ka puo o tla ba tlhalosa ka Xhosa. Then if ona la ba tlo re interpretate lang re tlo leboga. Over to you, Ms. Doda.
Thank you, DDG. Molweni, igama lam ngulindela Doda. I'll be taking you through the presentation. I'm not sure if it's showing on the screen. All right. So on the slide, I'm not going to give you all the details, but what the slide is showing is that the Gauteng province has the largest share of the population for South Africa. So in Gauteng, we've got about 16.1 million people, which represents 26% of the South African population. We're also telling you that the delivery for health is challenged because of what we would see on the news where the Minister of Finance cuts the budget. So the overall of that slide is telling you about that, even on the next one. I'll go to the budget. So on this slide, thank you. So on this slide, we are showing you that in the 2022-2023, the budget for the Department of Health has been cut by 21.5 billion. So I don't know, I'll go to the next slide, but that's what we are showing you. So these budget cuts, they have a negative impact on the filling of the position, the medicine availability, and any other resource or service that the department would like to provide. But we still try and provide what we ought to provide with the limited resources. So on this slide, we are showing you we've got about 8 programs within the department. So this slide is showing you what is the budget for each program. I think on the next slide, I will then tell you a little bit on what then the program do and what the focus is. So our budget, we had 61 billion in the 2022-23 financial year. So here we are showing how it's then split. So you will have the compensation of employees, which takes about 60% of the budget. We then have a budget for our goods and services, which takes about 32% of the budget. We also have transfers, and we also have a budget for capital assets, which amounts to 4.9% of the overall budget. So on the next slide, we are just talking to the issues of the allocation, the movement, and the decrease that we've had. But you will see that when we then go through each program in terms of what the budget is sitting at. So I'll also skip on this slide. It's just a breakdown and the detail of the numbers that you've seen on the previous slides. The budget assumptions, I will not bore you with that detail, because when you prepare a budget, there are some assumptions that you make in order to get to the number that you end up with as your final budget. That is done with the provincial treasury, which then also translates to the national treasury. So here, you'll remember there was a slide with the programs. We've got the program admin. Admin is sitting at a budget of about 1.4 billion. The main focus on the admin and the big chunk of that budget goes on to the ICT, which is where the department focuses on trying to modernize and have systems in place where we use more digital instead of the paper that we previously were using. And then we also have district health services. They have the biggest chunk of the budget because it's 4.6 billion. And that portion goes to the treatment and the prevention of HIV and AIDS, TB, and also some of the programs that are implemented by the department, like the program for the antiretroviral, the TB screening, and the HPV vaccine rollout, and the condom distribution. So those are some of the programs that the department undertakes, and the big budget is sitting there under the program 2. Program 3, it would be the emergency medical services, which is mostly our ambulances. So that budget goes on towards to buying and procuring the ambulances and making sure that we provide that service as the department. Program 4, which is provincial hospital services, it's got a smaller budget in the department. And the programs that are there is your maternal and neonatal accident and some of the emergency services. And I think now they're also including the mental health services under that program. Program 5 would be your central hospitals. It's slightly below your district health services, but those will be your central hospitals that do most of the hospital work within the Gauteng province. And the program is mainly funded through the grants, but I will not bore you with the grant details. And then we also have the health science and training. That one is more focusing on the nurses, the training of the nurses, and the colleges that the department provides. So the budget there is sitting at about 89 million. And then we have healthcare services. The budget is 412 million. The major portion goes to the laundry services so that we can provide the laundry services and the clean laundry within our hospitals, and also the food supply services. Then the last program that we have would be the health facilities management, which is your infrastructure program that's responsible for your maintenance, for your building clinics and all of that. The budget that we had for the 2023 year was sitting at about 2.4 billion for the program, and the aim is to make sure we design, deliver, and maintain the facilities that the department has. That will be the end of the presentation, DDG. I don't know if there's something you would want to add. Thank you.
No, thank you, Chair. I don't have anything to add to the presentation.
Okay. Hello, DDG. I thought o ka bolela le ka di APP nyana gore batho ba understand gore o di APP ke efeng le improve service delivery kai wa bona budget yona mara ho ne di APP plans tsa lena for the year tse le nyakang go di achieve, so be ke re kganthi motlhomongwe o ka ba prefers chaba hore okay di APP mo re bereka so hanyane nyana because nako re sana le yona a re shoti too much ka nako go no re chaba sebe le idea ya gore le nyaka go dira eng for eng byang just go no thusa gore ba understand gore ge le re district health services maybe go district health services ko di clinicing le be le hopotse byang kra re lena le no e presenta like di figure di figures chaba se bone mara maybe tlhalosanyana ke le fa chance a re fele pelo ka gore ba tlogile gole ba nyaka information bolelang ganyane go no re le di target tsa lena ke le at least tse di tlo thusang gore setšhaba se kgone go ba le input le di honorable members ba ba lemo ba be le di input wa bona di plan tsa lena for the financial year e tlo ba eng and then ka ngwaga o re o thomileng o ke eng, what are the main areas that you want to target ka this budget akere go infrastructure motlhomongwe le nyoko aga kliniki or nyoko feleletsa kliniki something like that gore ba understand mo le appointang people with disabilities nyana or senior management mile before ke le bala let me also acknowledge the presence of the sign language officials in our meeting. We appreciate it very much, sir. Sorry that we didn't recognize you. And also those who made us to be connected. You always are supportive of our programming. Le the leadership ya mola ho bontate makwala ba ba re capturang ge re bolela ka mo. Ra le leboha le lena ba botlhe, you make our work gore ibe mmereko sharp. Siabong. So DDG thusa gore o tle tlhaloseng di plan gore ke bolela sebaka so ke ra gore le ati prepare ka mo gore le kgone o tlhalosa mo ka gore presentation ya lena a se itse le 7 minutes ka gore ne le bolela ka di figure re di bone bo 20 million bo 4 million bo 4.9 million mara di tsamaelana le eng bana le yona information ba no ba le limited, so ba limited nyana mara a go tshwenya ke re a lokisa le nyaka sa mo gore ke a le bolelela gore ke ba tlogela ya DDG ba re ke ska le tlogela le tlhalose mo so that ba tloge mo ba le empowered gore no man ke bone ba re for administration ela ba ra gore mmola mo administration agere ka infrastructure ba bolela ka immola mo infrastructure le tlhalosenyana bo Mr. Khobo ba hona ka ba tla tlhalosa gore at least mo go infrastructure go na le sepetlele se se mpšha kapa go na le tleliniki e mpšha kae, something like that. A ke re nna a ke bereke le bona, nna ke nyaka bona ba tlhalose le nna ke kgone go ba empowered a ke re so ba tshwanetse ba outline le dipolane tša bona in the area tše bona ba berekang ka tsona gore lena le kgone go understanda di-health facilities. Clinic ya Moyo ke Moyo ne Moyo clinic e agilwe mara o ka re a iso bereke, something like that gore no ko Moyo be re tlhopha ke Motlhagatsi, ba re Motlhagatsi ke ona e leng bothata gore e tsene gore ba ko Etwatwa ba kgone go berekisa that clinic. Mara at least the plan ya rena go make sure gore within 3 months ke fa example wa kere e tla be e bereka gore kliniki e kgone go bereka e thuse setšhaba for example. So ke ra gore ke le fa chance setšhaba se re se nyaka sa mmogo a ke se poki mara ke re tla be go le unfair gore ke dumelane le lena gore no re ka 5 minutes mo public participation gape batho ba ka tla ba re ba se tle ka moso ba re bona ba e ka obane healthy e no ba shaya re shaya ne a ke re mo sharp DDG le official bolela msammo gore setšhaba se se tloge mo sena le idea gore okay ko Daveyton bile a go ne sepetlele, plan ya bona ke eng? Go na le sepetlele mo batho ba Daveyton a ba go kama ba Etwatwa ba hona go na le sepetlele mo okay le covered mara Moyo at least is a big clinic e berekaning for example. So DTG, over to you DTG.
Thank you, Chair. Ke a leboga. Maybe re na le what ntho e re bitsang gore ke strategic plan. So ke plan ya rona ya 5 years. And ka plan e ya 5 years, akere after 5 years ra vote. So re ba re tseba re na re plan ka Department of Health gore ka 5 years e re tla ba re etsa eng le eng. And then re na le plan e re bitsang gore ke annual performance plan. So for 5 years wa ke ra re ka se kgone go ira mereko wa 5 years ka 1 year. So re etsa plan e leng ka mo re tsa di plans tse dingwe tse di leng ka mo 5 years re di tsenye gore ka plan eo re tlhalosa gore re plane gore in that year for instance a ke re ngwaga rona re thomile ka April gore re tlo ira eng. Ke tlo thoma check some of the programs tse re na leng tsona. Re na le program ya dikolo a ke re la tseba gore gale ne re kry-a gore ba ba lekanang le nna ga ile ya ko sekolong nakong ne ba tla re o ka se tsene sekolo ka gore na le problem ya mahlo, o ka se tsene sekolo ka gore ngwana a gone o na le problem ya ditsebe. So re na le problem eo Chair. Ge re lebelela ka ngwaga wa 2021-22 ka ngwaga o fetileng ne re budgetetse go ira program eo ya dikolo e na leng 74 ya bana for 74,000 for ngwaga o fetileng le ona ne re na le bana ba leng 119,350. So the programs tse di leng teng hangata le kra gore batho ba di tsebe re etsa di problems a ke re nako ngwe go tlhola go tla manese ga le ba fitla ba re tlhaba ba tsamaya ba ro ka se bile polo o ka se bile polio o ka se bile TB le eng. County government now ina le di programs tse ngata tsa dikolo bana ba leng overweight nako ngwe ke re nako ngwana a le sedutla le re o ja gagolo nako ngwe le kry-a gore ke malwetse. Re na le program eo e re etsang in partnership le Department of Education. Na re program ya mahlo, re na le program ya go ba thusa with hearing, re na le problem ya oral. A ke re ba bangwe le kry-a gore ga ba boa ba startaro kry-a re sani. So aba thusi ba o fela ba thusa le bana ba ba sa kgoneng go bua mara also ba kgona go go ruta le bana ba bangwe gore ba ba accommodate so bana bao so that ba ska tlhola ba dula gae ba ra ba sa ya sekolong ka gore batho ba ba tshega go na le di program gape tsa TB tse rena le tsona le ba bangwe le kra ngwana o a le mosesane too much nako ngwe le kra gore ke malwetse mara a re wa bone nako ba re o tshwana le papa ha o tshwana le ramogolo wa gagwe le yena na le monyane nako ngwe kra gore kanti ke malwetse re sa wa boneng so ke program engwe e rena le yona e re budgetetseng re tlo ira ka yona so rena le di program tse 8 so program ya pele ya e rena le yona che ke ya administration ke mo le krang gore ke administration ya gore program e supporta di programs tse dingwe so ge re lebeletse ka mo di program ene ke bua ka yona the way ne re plan ka teng ge le lebeletse ke gore bana number ya bona ya increase because a re sa tlhola re kgetha gore ya go sekolong se feng re ya go dikolong kaofela so ke one of the programs e rena leng yona eo mara program engwe ke batlang go bua ka yona ke program 1 rena le office ya finance ke bona ba supportang everyone ka ditaba tse di amaneng le finance bona ke bona ba ntshang le reng ke no e beya hantle ke bona ba making sure gore ge rena le di supplier or o tenderile o tlo patelwa and then ke bona ba making sure gore di services tse rena leng tsona di a patelwa ke bona ba making sure gore ge ba ko HR ba feditse go ira di plan tsa bona tsa go patala babereki ke bona ba patelang so plan engwe rena leng yona ka mo program 1 ya finance go patela batho within 30 days gore go deliver le di services tsa gago re gona gore business ya gago e gona tswela pele ro patele within 30 days ke yona ya program ya finance e re planning yona and then program engwe e rena leng yona ka mo finance ke taba ya gore ba dila gape le ka di assets gore re tseba gore ko rena le ditulo tse kae rena le ditafula tse kae ke bona ba making sure gore re tseba gore ditulo tse rena leng tsona di ko kae ene di berekisa ke bo mang so ke plan engwe e re ikemiseditseng go etsa ka mo program 1 re improve gape go patala batho ka nako program engwe ke ya corporate services ka corporate services rena le ke mo rena leng babereki ke mo rena leng communications ke mo gona leng batho ba trainang di doctor le di nurse gona le batho ba dilang ka molao and then ke ko yona program re kemiseditse gore re lebele structure sa rena ke re la bona gore ke gale ge metota buile gore now number ya batho ba re ba bonang ba le di patients ke ba bangata so now re tshwantse re lebelle gape gore na batho ba rena leng bona ka mo health ke number e right and ba na le di skills tse right gore ba gona gore ba be ba thusa batho ka portfolio ya rena so re ikemiseditse gore this year re tlo lebella yona eo ya bobedi ke taba ya gore re make sure gore a re dule rena le tšhelete ene re sa hiri batho so re ikemiseditse go hira batho ka nako so that mmereko wa rona o gona go irega ka nako so ntho engwe e re buang ka yona ke taba ya gore a ke re ke buletse ka manese ba re ba trainang gore ba nurse ba re ba trainang re ba fa di bazari re ba traine and then re make sure gore ge jara e fela or ba fetsa training ya bona ge rena le diposo re gona go ba appointa ka gore re tla ba re spendile tšhelete ngata ya go ba appoint ya go ba trainer so ke yona eo ya manese engwe e rena leng yona ke taba ya di ambulance re make sure gore batho ba di ambulance tsa rona di tsamaya ka nako although re na le problem che ya gore nako ngwe gore a ba tswe ka nako ka gore ge batho ba founela bosiu ba tshwantse pele ba founele maponisa gore ba tsamaya le bona ka gore go na le moyanyana wa go hijacka di ambulance mara re plan gore ra tseba gore re na le system e bontshang gore motho founile ka nako mang and ambulance ya rona e tswile ka nako mang batho ba di ambulance ntengwe re planning ke gore ba appointa le bona ba be le batho ba tlo ba thusang ba bangwe di ambulance tsa rona ge re ka lebella se a isa tshwana le truck di ambulance tse dingwe di na le metšhini e batlang gore batho ba teng ba e berekisang ba trainilwe program engwe e re na leng yona chair ke program ya ya security a ke re la tseba gore le security re na le problem gore batho ba tsena ka mole nako ngwe ba tsenya ba na le dithunya ba bangwe ba tsena ba na le ba fitla ka mole o le kry-a ba utswa dilo tsa batho so security le yona ke problem e re na leng yona re plane gore re be re improve security ka all facilities not go protecta babereke ba rena fela but go protecta le di patient gore batho ba tsenang ka mole re be re tseba gore ke bo mang and ba tlo bona mang and ba tshwara dilo tse ba ka bulayang batho or ba gobatse batho program engwe e re na leng yona ke e ranang ke Ntate Khobo ya infrastructure ke yona e making sure gore di clinic tsa rona kaofela di infrastructure yona ya bereka so that batho ba gona go ba le comfortable ntongwe ba irang ke maintenance ke bona ba making sure gore ge di toilet di sa bereke ke bona ba tsamayang ba lo di fixa ke bona ba making sure gore mo community ina leng batho ba ngata ke bona ba agang di clinic le dipetlele ntongwe ba irang ke go make sure gore di projects kaofela tse di na leng infrastructure le ko head office not di clinic fela ke bona ba re lokisetsang go batla go paintiwa or go batla go fixwa metšhini kaofela e re berekang ka yone so ntengwe e re buileng ka yona ke taba ya gore ge re lebeletse di-programs tse ringwe tse le na leng tsona ke di-programs tse le tholang gore batho ba di tsebe tsa go tshwana le tse di ranang ke bo mamope tsa HIV tsa di-TB aba treat TB gape ba re ruta le gore re tsebe gore ke eng se re tshwantseng re se etsa gore re sa tshwara ke TB and ke eng se re tshwantseng re se etse ge re tshwere ke TB and ba gona gape le gore ba ye ko dikolong le gore bona ba sebetsa ka gore ba re gopotsa before re tshwara ke malwetse and then ba make sure gore ge malwetse ao a le gona ko dipetlele or ko di-communityng go irwa eng ka tsona so ke tsona di-programs tse chair mo ke tlo fitlhang teng ka di-programs tsona tse ntho engwe e leng teng ke gore in most instances re na le some days in the health calendar tse re di celebratang and ke yona mmereko wa rona la gore go tshwana le today batho ba understand gore go ka tsamaya o le ko strateng o bolaye nurse o tseba gore batho ba ne ba tshwantse ba bone ke nurse eo ba 50 now clinic eo e tlo ba le problem ntho engwe re etsang le bone ka the previous month ne re na le TB program and then gona no go na le malaria so le bona ke dilo tse ba di etsang gore ba be ba re gopotse gore tshwantse re be re etse eng ntho engwe e le etsang ke gore go na le program e trainang bo doctor le di-nurse re traina bo doctor bao ga ba fetsa go traina ba tla gape ko dipetlele tsa rona le manese ba fitlha ba ire community service and then ga ngata ge ba fetsa ba bangwe re ba rena le diposo tse re di beileng gore ga ba fetsa ba berekele mmuso mara ka nako ngwe ka taba ya budget a re kgone go ba tseya bo botlhe so ke program engwe e leng teng e rana ke corporate services under HRD engwe ke e ya gore batho ba be le wellness gore re make sure gore batho ba rona ba dula ba le, because le di doctor le bona ba na le di problems, le di nurse ba na le problems, le nna ke na le di problems, ke wellness gore e prepare batho or e thuse batho gore ba kgona go deala le di issues tse ba na leng tsona, so that mereko wa bona o tla ya ko pele. Problem engwe ke na leng yona e batho ba ngata ba na leng di problems le kra nako ngwe motho ya ko spetlele doctor a bona gore motho gantle gore o tshwere keng, or motho fitla a na le in a situation ya gore a gona di doctor tse di enough ka nako e, or nako ngwe a ba motshwara hantle, or a ba nako ngwe ba kra gore ba ignorile go etsa tseli tsela. So hangata le kra gore batho ba re sua ge batho ba bona ba tlhokofetse, so re na le unit e buelelang ka litigation ke bona ba dilang ka di cases tse di tshwanang le tseo. So Chair, I think ke buile ka tse di critical in the department tse di leng relevant go batho ba rena leng bona. Ke a leboga. Sorry Chair, I think the other one e ke lebetseng go bua ka yona ke quality assurance. Quality assurance ke batho ba le ka complainang ko bona le butsise ka di clinic le butse gore ke mang motho wa quality assurance. A ke re nako ngwe motho ana le complaint ge le ma comrade ba tla ba ngwaletse MEC, ba ngwalela HOD, ba ngwalela everybody. So gona le batho ba quality assurance ba dilang ka di complaint. So unless if bao motho o ko clinic eo or le manager wa clinic e motho a tshwereng clinic eo a ba dili ka tsona di issue tseo, then le ka gona gore le tlise ka mo central office, so that ba gona go le thusa gore le tlo ira eng ge o na le complaint, and then go dilwe ka yona re latelle. Mara nako ngwe ge le romela MEC le kry-a gore now e tlo tswa gape ko MEC e fite batho ba 8 kanti nkabe le ile ko clinicing or ko hospital le botsa gore ke batla motho a dilang ka quality assurance, ke batla go complain, le complainile o tla le fa reference number and o tla le thusa go solve the problems tsa rona. Thank you Chair.
Re a leboga DDG yo ibile o boletse sebaka baka go feta presentation. Rena re tlwaetse presentation e ba long, mara because re kopile gore at least o tlaleleditse go feta presentation. And last year a ke re rena re track a record be re na le di slide tse dintšintšintši maybe tse 70 ke sana le yona mo. So yeah, today o ka re ne di le 5 re kgopela gore le improveng le ska tla ka tsela e ge re ya hape public participation le tle le information e otlhe ene e ngwadilweng e tlo bontshang mo la mo screening ka gore setšhaba sa Gauteng se nyaka go make sure gore le ngwadile mo la dilo tse le reng le promisang setšhaba sa Gauteng. So re a leboga gore o tlaleleditse mara next time re kgopela di tle di ngwadilwe di ska ba fela ka molomo so that re tshepe ka nnete gore dilo tse di ka mo nthong ya department. Mara re a leboga because o tlaleleditse rena re nyake go senyetsa setšhaba se sa rena. And last time ba rile di kae ditokomane tse re yang ka tsona hae le be le hona ko sedibeng he ba re e kae hard copy. So ge le tla next time le tle le tshwere di hard copy tse batho ba ba leng ka mo meeting, unless if di ka mo di plasticing a ke sure. Mara he le ka tla le di hard copy ba ya go fa di feedback di community e ba fitla gore be ke ile ko multi-purpose center ya kae e kurulene tshepo then ba re so gore ba kgone go tracka gore ba bone gore ba rile ba tlo dira at least ba tla kae. So re kgopela gore le ska re shaetša go ya pele ka gobane rena re tshepile lena ka gore rena re overseer lena. So ke a leboga gore o tlaleleditse and then ge re ya ko pele a re berekeng mmogo at least o tlhalositse le hore ba berekelang department, for example, le nyaka ba patediwe within 30 days ge ba tlile go fixa something ko clinicing, saying after 3 years or after 2 years or after 6 months or after 3 months, or so even within 30 days, so that ba be le matla ke re go aha go ya go lokisa tse dingwe go ya pele. Re a leboga o tlhalositse, and then re file a message for next year. Re tlo ya hana bile le ka se presente ge le 5 slides next year. Ge modimo a sa re beile re tlo hana. Re nyaka full presentation. Ke a leboga. Setšhaba, re a leboga ka hobane ba presentile bile ba tlaleleditše ba bolela ba tlhalosa. Ke nako ya lena hore le kgone go di re ke kgopele ba portfolio ba ba leng mo maloko a portfolio go ya ka program ya rena gore le bona ba fahlele ka mkgo ba ka kgonang mo budgeting nna ke chaira meeting mara ke kgopela gore the honorable members ba be le seabe mo tabeng ke thobe ka bona, and then ke tla go lena, and then re kgone go tswela pele mo go lena. Honorable members, go na le o a nyakang go bolela se sengwe mo budgeting e presentilweng today mo meeting wa rena? Ke tla re member Mfikwe ke number 1 ya bolele. Tela ke member Kanyana.
Thanks, Chair. Re dumedise setšhaba sa Etwatwa. Re dumedise the members of committee le the officials tsa rona. Just a few questions that I want to ask, Chair. On the district health system services. Presentation e bua ka integrated school programs. So if we could be given a brief of what are those programs? And also the presentation says we're working in wards as well as in the community. If we could get a provision, at least be provided, Chair, to the committee on the wards that we're working at and what are the actual programs that have been implemented. Then on the emergency medical services, we generally have a problem, Deputy DG, with ambulances. What I'm asking is, I know there are SLAs or agency agreements that we have with the metros, the municipalities. So my question is, how far are we? I know that for the city of Johannesburg in particular, the province has taken over the running of ambulances, Chair, and that presents a problem in relation to turnaround times to the communities and when there are ambulance call-ups. So I would ask a question that says, which metros are we currently working with? Are the SLAs still intact? Because we had appointed metros as agencies for them to be able to provide the emergency services for us. What are the turnaround times that we have in relation to call-ups of ambulances when communities are calling in at the call center, as well as how many ambulances are dedicated to our municipalities? My last question, Chair, talks about the health facility revitalization. The grant, what is the grant meant to do, and how is it benefiting health services in our communities? Thanks, Chair.
Leboga Mhlomphegi Mfikwe, can re Mhlomphegi Kanyane?
Le nna ke dumedishe. Putswa ka ke mabapi le infrastructure. Mara ke bea base mo population ba bolelang ka yona gore Gauteng population e ya godimo. And ba bolela ka gore šetše re fihla boma 16 million. And a kere ke a lebelela dipetlele tša rena di a shorta. Yaanong ga ke tsebe gore na as the department go na le plan ya go oketša dipetlele or le gopotse jwang šetše mo budgeteng le itsentšhitše gore re kgone go meter population re na le yona 16 million. Now plan ya lena e mo kae go oketša dipetlele tše? A ke le a tseba bentse go bolela ka taba ya bo Captain Park Hospital ba re sa le tswalelwa, mara ke a tseba gore yeo šetše le tla kgole le yona go na le dikarabo godimo ga yona. Sela sa Carltonville sa le tswalelwa le sona, but ke no ra ona gore le budget ya lena le plan jwang go ka kgona go dira tabe ya dipetlele. Ke a leboga.
Re a leboga morena Mohlomphegi Kanyane. Go fokotša malwetši mo Gauteng, plan ya department ke eng? Go fokotša malwetši, di-diseases, a kere di gona like ge ba eta ba boletše ka bana ba rena ko dipetlele ba ba nang le mmele. Now mo go ba re ke eng outreach le plan ya lena ke eng in terms of outreach ya lena go try go fokotša malwetši ya ditshwikiri? A kere bolwetši bo bongwe ba tshwikiri ke lifestyle, gore re ja eng, re nwa eng, a re dire eng, ke type 2 diabetes. A kere mammope ela a se ya tlhago ya gore e notlile, ke ka se re se jang rena. Ge re ja bogobe ra ithuru go sene merogonyana go sena di-fruits ya re tlela. Now department e planile go thusa setšhaba se sa Gauteng bjang gore e fokotse malwetši a tlisang ke ona a re a bitsang a lifestyle. Ke no fa example ka diabetes ka gore ke yona e re kry-ang ka baka la ra re sa ja dithotse, ba ba tsebang dithotse re sa di ja, ra di nyenyefatša, re ja kota akere ene re ja kota le acha letšatši le lotlhe, re ja bogobe bo bontši. Dilo tseo a di re thusi ka selo ka gore di re tlisetša yona ye DDG a boletseng ka yona ya obesity, napile ra ba le malwetši ya ditshwikiri. So ke tlo bušetša go lena go araba tše di botšišitše mara before a re boeleng ka mo go setšhaba le bona ba tlaleletše gore ge ba tlo araba tše re di botšišitšeng ba tla le lena e bane lena le dipotšišo. Ke tlo re ge le nyaka wa baneng dipotšišo ba emise matsogo ke le fa dinomoro, ene ge ke dingwadile mo sekebe go a tsena o mongwe le o mongwe ga a emelela a re ke nna number 1 ka re go ne ba bangwe ba emisi matsogo, mara he ke tlo re number 9 o kry go ne number 9 tse 3 a kere ke phoso. A re emise matsogo ba ba nyakang go fatlhela mo presentationeng ya rena. So ke tlo le fa mabitso nomoro ya gago go emelela gore nna ke nna original number 1 or original number 6. Gale ke bereka le ba bantši ke a tseba number 1 original, wena 1 ya kere ka mo 2, yes 2, 3, 4 e tla tla ka mo emang pele ne emanyanang pele rile 4 a kere 5, 6, 7 ya 7 e kwa ka mo number ya 7 e ke ka 8 same row 8 ya yes 9 a kere ba fella ka 9 ka mo Tene okay. Ai man a per ka se 2 and fro a kere. Ge re thoma mori ya so, a re thomeng a fresh. A re thomeng hape emisa matsogo le felelele ka mo. Number 1, number 2, number 3, number 4. Number 5. Yes. 6. 7. 80. 80 yes. 9. 8. 10. Sharp. 11. Pomorao. Kinali 11 matsogo kam. And umulomung, they know their numbers again. Yeah. So ki 11. Original again. Bau inamela ifufa. Baskar zenele. Number 1. Okay, number 1. 2. 2, ma'am. 2. 3. 4. 5. 6. 7. 8. 8. Sharp. 8. Let's come. Originals. Number 1. 80 ke ka mosaiting ye. Ka le. 11. Kamuke 80 ke ka kamuke right. Kamuke left. Number 1.
Ke thome.
Go ka bolela godimonyana.
Ke a le tamisha. Maina rena ke bo JM Skukhune. Ke tswa ka re Thabiseng ka Provincial Spirit. Ke bolela gape.
E biele go lenyana
Ke re ke a le tamisha.
e biele go le wena ya
Ke a le tamisha.
okay
Ke a le tamisha. Le mpotseng gape.
ke motloela
Le kae? Ya maina rena ke bo GM Skukhune from Thabiseng Provincial Spirit. Modula stulo. Ke nya go tishetša. Ke tloga ke dira ka borena. Ka ge le bolela le re ba le ba ka mo department eki. Ba dire shosho gore ge ba etla tšatši le leng ba bitša gote. Go be le dilo tše di swaregang di tšwang go bona mo godimo ga batho ba tlo kopana le bona ba re a ba tlo tloga ba ya magaeng. Ba tseba gore ba swere ntwe swaregang ba kgone go addressa setšhaba. Ba fe setšhaba information e tletšeng. Gape ya bobedi ke nyako tseba gore ge ba bolela ka dipatšete tše ba bolelang ka tšona di gona seo se ka dirang gore ditleliniki tše di saleng tše nnyane ba ka kgona go di oketša na. Gape ya boraro ke nyako tseba batho ba le ba go tsena di door to door gante ke permanent mola gore ke contract na because if e le permanent le tlhaloše le hono gore ke permanent ge e le contract banke ba tšwe go tsene ba bang le bona ba kgone go thuša ba bangwe. Kgomo ya ga Skukhune a ntšhe boloko ka moka.
Number 2.
Hi everyone. My name is Gladys Holinyati. I'm from Western area. Kenako Simunye Extension 2. I'm one of the clinic committee members. We're not facing much problem, but Kemathata go dila le di patients in which the patients most of the time they don't understand when it comes to us explaining to them whenever ba thola line e le telle kapa line e sa tsamaye inside the facility or the clinic, it's not because of the nurse they breaker or aba batle go sebetsa. Those people are working and they are working under pressure. So all we have to do ke go ba explainela gore no guys re kopa le beng patient ba tlo le thusa and the nurses tsa rona tse sebetsang today had enough. So we asking the government again gore e ka re ba ka etsa ka bonako gore ba hire di nurse, go tlo ba le di nurse tse enough inside the facility so that the patient tsa rona di kgone go di ska dula nako e telle ko di clinicing because they complaining ka gore ha e sale ke tlile ka 7 go seng ke tlo tsamaya mo a clinic e kwalwa. So all we ask from the government ke gore go iriwe di nurse tse more le di sisters di be more so that re kgone go balance taba ya nako. And again, di clinic tsa rona di nyane. O tla kra gore yanong a re kgone gore di patient tsa rona di ka kena kaofela inside the facility. O tlo kra ba bang ba dutse montle and yanong go a tshisa motho a kula o ka kra mong letsatsi la motlhola. So I don't know whether the government ka re thusa gore e ba agele meritinyana gore at least antse ba emetse go ba kene ka mogare ga di facilities tsa rona tse nyane ba kgone gore at least ba nne accommodated ka montle ka mole ba sa fila ekete a ba khathaliwe. We do care if re ne re sa khathali Department of Health is a le khathali or tsone di nurse or bone batho ba tshwereng di clinicing ka be ba sa re hira us as clinic committees gore re beteng re tlo khona go le assista re le tlhalosetse whenever le na le mathata and le di complaints tsa lona not to say ha le kentse di complaints inside those complaint box we don't go through them. We open the box, we go through your complaints, we find a way of solving the problems tsa lona. Not to say he khangata tlhole kutla ba re la ditsale di latlhela ko di thuteng ko di dumping no a go yalo ga di bula ga di bala our sister in charge e dula le gona ko fatse ga bona go di problems tsa lona ge di solve yang not to say a re khathale ga le khathalla and le nna azanka re no I am just going there for fun no ke le ka re ka volunteera ke batla go explain di patient tsa rona di itse gore we the clinic committees re emetse community re emetse bakudi ba rona re emetse each and everyone o tlhokang thuso regarding healthy and whatever fela tlileng ka yone. Thank you.
Mr. Kobo, community e complaina ka o tlhoka shelter ge ba emetse go tsena ka clinic mo le tshwanetse le be le plan le rena gale re raiser gore ba ema letšatšing mare ha a etla ene ke monyama a ba safe because ba tla frugu go nidega plan ya gore ge ba le ka mola ba be in a safe place ba emetse go tsena ka clinic eo yona e tobile wena gore what do you do? Most clinics space ke se senyane a gone shelter le madulo and the clinic will not function if there are no people coming. So it means people they want the clinic to help them, that's why they come even when go tonya, even when it's raining. The umbrella di queuile outside the clinic because e bula ka nako e itseng. Thank you. A re ko number 3.
Dumelang. Na lebitso la ka ke nna Lerato Molete ke tswa ko ward 119 ko Slovo Park. From the budget ene e raisitswe mo this training aka utlwa le caterer for batho ba di disability. And then mo tabeng ya youth employment empowerment the skills ala bua ka tsona but besides from training the nurses studying already mo le di doctors. And then the system ya o dila le di nurses studying route ile ya raisiwa kwa ko sedibeng but also change next ke system e feng e sebediswang ho dila le behavior e jwalo. And then mo tabeng ya infrastructure ne ke kopa it's just a plea le thuse batho ba di disability because ba bang ne ha bana yona tšhelete ya patala di private doctors gore ba ba thuse ka di exercising and stuff like that. And then ne ke rata mo one of the programs tsa lona tse le tlo di implementang or tse di leng already on the way. Ale ka kenya di programs maybe tsa bo teenage pregnancies di atraswe ko dikolong and then kutlule mem o bua ka taba tsa una le awareness ya malaria and stuff rona re le so a re kulu every day and then we won't be able to reach clinic for that kind of information. How about o be le batho ba ba tsamayang ba thole incentive nyana and then ba rute di communities ka yona this awareness. Thank you so much.
Thank you. Number 4.
Thokozani. Kena Maleshwani Sipula. I'm from Forgeville. Na ke kopa ho botsa mo ya di school programs. Utlwile mme Basani Baloyi a bua ka di eye programs, the ear and oral. So now ke kopa ho botsa hore is it already in practice or is it still on the process ya hore e tlo ya ko dikolong? Because now personally I've been signing the forms tsa hore ba ngwana tlholuwe bo matlho ko sekolong ba di romela akere to get permission from motswadi, but it doesn't happen. And then my second question goes to wellness. Akere ho thwe is to help people deal with their daily problems. But gudle mme Basani a bua ka di nurses, doctors, etc. Nna ke kopa ho botsa hore community yona, because now you can go to the clinic, o fihle mo ha o fihla you would book for counseling. Mama ka ke kopa ho bolella especially ko thusanang ke tswa Forgeville. Ke kopa ho bolella 5 years e ka feta. O sampane o emetse counseling. So now ne ke kopa hore le mo ke tlhalosetse hore at least go tlo diliwa yang ka ditaba tse yalo, because last time I checked re na le di social workers mo di clinicing, re na le batho ba beetsweng hore ba ka re thusa ka dio tse yalo. But then ka hone ha yo thuso eo le di suicide di a nyoloha because people don't get help. Yona ne ke ipotso tsa ka tseo, ke a leboha.
Thank you. Number 5.
Avil.
Covered. Number 5 is covered.
Number 6.
Dumelang bagolo. Nna ke o ke tswa ko Kagiso. Bathong health. Bonkgono ba rona ba mixa le di passengers ba ema ko renkeng. Ba fola line e qala kwa e tswe ilore ko renkeng. Di taxi ba thunyana anytime. Ha go ka etsagala gore go thunyaniwe go etsagalang ka bankgono ba ba emeng mo lineng ba bang ha ba itsutsa ma ba bang ba tsamaya ka dithobane pula yana go a tshesa go a tshwana a gona difference. Please re kopa le implementing whatever e buang le yetsa, because this thing batho ba sola ko di gating tsa ko clinicing go sna nurse e leng gore ya attenda or go etsagalang. Le tsone di complain tse re di kenyang ra di kenya, yes di complain, but ha di attendiwe. O ilo e botsa mang ha o ya o re ke leile complain o e leile neng ko mang o ka se re ke leile maobane, but then ke kentse mo boxong a ke itse ba e bulaneng a ke itse ba e balaneng a ke itse ba e latlhela kae. So please bonkgono ba rona go na le bana ba bo matere days mo di lineng, go na le bana ba bannyane, go na le bo epilepsy mo teng mo go busy. Di taxi ka mo le tsone di busy, everybody busy ke rush hour. Please re ko sona po gona go wes ke clinic ke renke line e a tswa ke ele e ya ko renkeng. So please ha le batla di voutura le voutela la tsena le etsang ha go tshwantse go implementiwe dololo. Please.
Number 7.
Number 7. Thank you, ma'am. Sanibonani. Umam Ngomezulu lokhulumayo. Ngihlala la Etwatwa West Ward 67. Iclinic yam iJoy Clinic. Before ngikhuluma who is in charge ku transport? Before ngikhuluma ngicela in charge ku transport iqala.
Ora transport ya ambulance.
No, wait for me first.
Oh,
Yime ngikhulumayo ene yime engidisable. Nothing about us without us. Ngicela ume kancane. Njoba ngibuza umuntu transport.
Mamkomezulu.
Yes ma.
Ubutisa rena or ubutisa mang?
Ngicela ukwazi icala ukuthi uphi umuntu organize ama transport icala.
That is why I'm asking hore unyaka hore na ko ambulancing or lena heli tlakam.
Hari tlakam.
Oh.
ngicela isisutha ngisazi ngumZulu.
Hayi wena khuluma mina ngiyakuzwa.
All right.
Mara-
All right. Masiza kanye ngapha ne mama. Sibuya le phansi west enesikhuphuka ibridge enengihamba nabantu abangaboni ne and nami ngokwami I'm disabled but mangibheka la ngaphandle ama transport there are so many bengicela ukucela nje ukuthi if ever sesibuyela emuva kube nento esithathayo isibeke ngiyacela lapho isicelo.
Okay, wena you must uze ngizoza kuwe si arrange leyo yakho.
Ngiyabonga sithando sami. Thank you my darling. Sengiyaqala ke ngiyakhuluma ke. Yes. Njoba ngikhuluma ke okokuqala ngifuna ukwazi ukuthi akhona ama ambulance la ngaphandle na. Akhona ama ambulance angithi awekho ama ambulance. Njoba ngekho ama ambulance la kunabantu abagulayo kunabantu abanama epilepsy kunani if ever umunye umuntu uyaquleka la iphi paramedic la ezomsiza and kunomama engimzwile akhuluma ngama ambulance lapho ngicela ukukuphikisa sithando sami ama ambulance awayenzi next nothing yangiva mama last week Monday kunomama benginaye agula ngifonela ama ambulance kwaze kwaba 5 times azange ize ne1 size saqasha imoto yamuse Far East makafike Far East wathothi sekayashona inkinga yabo bani ama ambulance lanko wabeka phambili ngawabeka phambili ama ambulance clinic ne akhona ama clinic sawabona kodwa sivuka ekseni siyokufola lapha masiqeda ukufola lapha yana masingena bazothatha amakhathi wethu but still we are going to wait simele ama-file and mawuqeda uthuthi baba wamemezela elakho ifile alikho mawubuza lilahlekile ama-file alahleka kanjani kanti ahlala endaweni eyi-1 nathi siyile esikoleni singawuthola itohonyana lapha sisebenza ukuseva lama-file lanka ukuthi abe right and kunento esiphatha kabi thina singama disabled futhi especially mina engihamba nabantu abangaboni ema-clinic abanama right ukuthi if ever umuntu o disabled owumama a pregnant bambuza ukuthi kanti wena umitha kanjani ungaboni kusho ukuthi yena akanamizwa na akanawo ama feelings yena kumele ngabi nomuntu owesilisa eduzane ngoba akaboni amanesi afundela ukuthi kumele ukuthi ayenze izinto eziright kithi kodwa abazenza izinto eziright kithi okumanje ama chronic bathe bazawa deliver ezindlini abasadeliver ba relax kumele ukuthi ama medication abo mawaphelile kusukume thina nanko wami ubaba kaboni mara yime kumele ngisukume ngihambe ngeclinic ngomlandela imedication but they call themselves amanesi umsebenzi amanesi kahle yini ngiyacela ke ngoba sengikhulumile ngiyethemba ukuthi ngizwakele please do something especially for ama disabled nama old age ngoba ngibona ngathi wona valeleka ngaphandle isikhathini esiningi ngiyabonga
okay man asemmereko wa manese go deliver ditlhare DDG o tla araba hore ke bo mang ba ba leng responsible go distributor ditlhare le go di isa go community so manese tshwanetse ba bereke ka clinicing mara department must know hore ke di bo mang ba di driver ba ba appointileng go isa ditlhare go mahaeng so go lokile mam Komezulu ba tla araba mara ya di nurse yona ke nya ka o protector di nurse gore for distribution ya ditlhare no bona as ke na nursing duty serious that one number 8
Dumelang nna ke nna Peter Manamela ke dula mo Etwatwa ne go khopela gagolo mo dipetlele ke buella gagolo bona batho ba ba sa boneng mabapi le nna haholo. Ne ke tsamaya ko St. John. Ke feleditse ke sa tlhole ke kgona ka taba ya budget. Ka gore ne ke na le motho ne ke tsamaya le ena. Ne ke feletsa ke mmaka haholo, then mmaka ile a tlhokofala. Ba latela ngwanaka le ena ngwanaka o tlhokofetse. Ne ke na le ngwana e one. Mosadi a ka na le matshwereng teng le tona. Yana ke na le bothata haholo ha ke kgopela motho ha mtheletsa ba na le go fela pele. Yana na ke batla go tseba gore na thuso nka e kry-a from ditlhare tse ne ke di tshela from kwa ko St. John di ka kgona go tla mo PBH na, or ba re zamele di-ambulance yana ka ge le bolela ka ambulance. Haholo rena batho ba sa bone re na le mmereko o montši ka gore ga o kgopela motho fela gore a o felehetse wa tenega ga ntshwara ka letsogo ga nkisa ko St. John. Motho o le ga a boa ga sa ipatla o mpatla tšhelete. Ke bua bjana ga ke sa ya ke ke tshwere 2 years or 3 years. Bjano se re no dula ka gore a se re dutse ka go rata ke tšhelete. Pelo ya ke ba botlhoko ka re thuso ne ke e kry-a gona moo ka re kile ka thoma from PBH ba tlholega but kile a re mmaka sa phela a re ye ro leka ka ya ko Dr. Mahlasi and transfera gore ke ye ko St. John maybe ke tla kry-a thuso, and kile ka e kry-a thuso ko St. John. Ko St. John ke kry-ile thuso matlho a ka a leka mara ka gone yanong ka gore ke budget a ke sana next a ke sa kgona go na go ka kgonagala bjang gore ke nka kry-a ditlhare ka mo PBH or le re batlele transport e ka re isang ko St. John. Bjana ka ge di-ambulance di lata batho ba ba kula gagolo rena ba sa boneng ke tshwanetse re be le yona ambulance ya rena e tla re tseyang e re ise moo ka ra give up-a gona bjano gante thuso ne re e kry-ile. Matlho a rena ne a tla bona ka gobane ke matlho ke a sa bona ka eng a re sana thuso re a defaulta gona bjano. And o boletse doctor gore ge ke sa tlhole ke tla matlho a wa yo feletsa a sa bone pele, and ke yona ke e bonang gore ke tle ke eme bjana ke emisa ke yona lebaka leo a thoma a nyaka go ba blind gagolo ka taba ya ona ntšheo a mantšhi a ke na ona.
Thank you. Number 9, original number 9. Yeah. Go ahead.
Molweni, igama nguNozuko Lusiki from Tsakane, Ward 99. Okokuqala ngizokhuluma ngendaba ye-ambulance. I-ambulance kahle kahle is a challenge. It's not like ngivile ukuthi ukhuluma ngendaba yokuthi i-ambulance zine problem ebusuku because ziyahijackwa. Same applies nomuntu.
The issues that appears here, we did raise it. About the queues outside the clinic.
About medication ya tlhogo. And ha ke itse medications tsa lena most of time, do you test them before le di fa batho na? Because ke ne le situation ya gore ko clinicing
how lo la khale le clinic ya rona ya bona e nyenyana. Re na le shelter e nyenyana mara e 5 rooms plus 1 toilet. Even sister ha sa batla le go bona mo go rona re fihla le counselor a re tla ka leshano ho yena mo. Ha ina shelter pula ha ina hona jwale re tshaba lo ya re lo check ke sono bana ba beuwa le ka toilet ai batho ba modimo ha rona re sa tseba jwale government ya rona jwale e re fila
kana disappointment ngama coordinators
o mong a bolela mo hore o sala o fitse formo o isa ko sekolo okay mme o isa ko sekolong ene ko sekolong ya hore everything is paid.
Thank you, Chairperson. I will start with the first questions which were raised from the table. The first one was about the health facility for the numbers, for now at least. The new clinics also cater for rehabilitation, and somebody asked about that. The old ones, of course, do not. One of the problems we have with the old clinics is that not only the clinics are small, but the yards themselves are small. You find there's only a meter away from the fence. And so in those we have to look at different things. For example, talking to the library next door, for those who are coming from there, to say if they will move, then we'll take over that space. Because there is nothing what you can do. You can't actually extend that. There was a question about contractor allocation. That is the job which is done by our sister department, DID. But my understanding is that you need to register first, and then you can get the job from that list. That covers then the questions I picked up. Thank you.
Chair and committee members, and apologies. 011-564-42211. If you ring a mola, if it's a good. Oh, 4221. Sorry. Retlying while fast. 4221. It's a stroke and then 2, 3, 4. Apologize. Sorry. Sorry. So that is the one issue. Mara ke kopa hore ke chair from Fanako, and maybe the last issue that I raise up. Provincial government or Puso will never have enough ambulances for the amount of emergencies there in the province. That is why Etwatwa hore rebelli tuto about who define the emergencies, or the ambulance, di butsuwe fela for the medical emergencies. That's the first one. The second one, as long as renally too much preventable trauma and injuries, the amount of ambulance that being committed, and I'm not here to make excuses for the ambulance. There's a lot that must be improved in that area, including the speed, access, and defeat mobile to Mara, in the context of the provision of health, Rena as citizens also re-improve from that end. And lastly, I'm linking this with one earlier on. The programs and partnerships with the department, especially the promotion. If community by identify ba struggle like a teenage pregnancy amongst the community. Balata department bare, leina as a department, re kopa letle le bereke le rena as a community who address this issue. Of course, also a manskarale might be a different issue, might be maybe issue anyao. You're able to identify as a mududi, as an observer as a mududi, kiboni hore as a community. Renara Sokola Kataba, so who approach a department through the district health services will avail the resources, including when the communities organize themselves, whether Kekokereking and other activities. The department is always willing to partner for the purpose of spreading educational program, including more knowledge programs like the wellness, whether they organize it with a fun walk, a fun activity. The department will avail resources to educate and train as part of the partnership. Chair, maybe
of our staff, including nurses and ambulances. Helena Lidi complaints Zadi attitude, Zadi nurse, or or any of our staff members, or maybe Lile Hospital Balasalitara Handle. I want to give you this number. Yahoo complainer. The toll-free number is 0800 0800 203-886. 0800-203-886. Literamus. And then gape go na le ka romela le SMS ke 35023. SMS ke 35023. And then email ki baba na leng di email ki patients PATIENTS patients.health@gauteng.gov.za. Alternatively, support support@gauteng.gov.za. Thank you, Chair.
Thank you, Realeboha, Department of Health, for the responses. Kantle le ho senya nako, ke rata ho leboha Department of Health hore e tlile ya kgona ho araba di questions. Ke rata ho leboha committee coordinators le support staff se sohle sa department sa committee hore ba kgonne go ba mo meeting. Ke lebohele ba Hansate ka kwa ba kgonneng gore re kgonne go bolela ka di mic tsa rena. Gore ba botlhe le ba sign language ke a le leboha. Ke leboha le lena ke bona matsogo ke nana re lena ba le emisa matsogo e tla mo tafole le tlo bolela gore what are the issues, because department has responded. And go le isa matsogo le ba ne ba sa re matsogo. Ke kopa le tle mo tafoleng lena ba le emisa matsogo le tle le tlo bolela gore di issues ke eng, because ba rabile di question tse di raisitseng ke ba le ba level what are the issues. Ke tla make sure gore ba tsamaye because the questions tse le di raisang di ya go bona. So ke le bone 1 2 3 4 come and wena wa dermatologist acting HOD o tlhalositse gore o need a referral le nna I think ke rile ke sa bolela ka cough mar I deal with leboha dijo di tsamaya. So ke le leboha gore le tsere nako ba lebo I think Mrs Mkomezulu ke lebetse mara re organize transport gore le ska ba le bothata le boela hae le team le tlile le yona memkam. Okay. Ba bohle ba phelang ka disability ke bona dinamo le bitsang le nne mo fatshe mo ska la ya kwa la ya go kra le go tlhaka mpiki o enu gore a kgone go leisa lining lena le tlo latela and then le skebela ya le ka mola khoneng ba bang ba ikisa ka khoneng and e ronta ba eo because ka mola go na le protocol e itseng ba beile batho ba ba rileng. Tempi will help you. Ka le leboha ipaphathele matsogo gore le bile sharp. Re feditse le tsamaeng pila morena tsamae le lena ba bohle lena ba matsogo e tla